Hi, we're Group 13, and our intervention is unintended pregnancy prevention for the Latina population.
The health behavior we will be targeting will be unintended pregnancy. The intervention will be an after-school program and an online app. The target population will include 2 segments. The first segment will be non-sexually active teens, ages 13 to 17, and our second segment will be sexually active Latinas, ages 18 to 22. The reason why we chose to target unintended pregnancy in Latina teens is because 49% of pregnancies in the United States are unplanned. According to Healthy People 2020, there are 40.2 births per 1,000 teens ages 15 to 17. The reason why we split our target population into 2 segments is because, as it can be seen on this chart and circled in the green and yellow boxes, Hispanics are more likely to begin having sex after the age of 17.
Our target behavior will be the prevention of unintended pregnancy. Our target audience will be the Latina Hispanic population, ages 13 to 22 years old. Our audience will be segmented into 2 separate groups. The first group will be specifically for the after-school program and will consist of young Latinas ages 13 to 17 years old who attend Montgomery and Southwest High School in San Diego County, as they both have a high Latina population. We are assuming that the audience is not yet sexually active, but may be planning to be, so our main goal is to educate them about sexual and reproductive health. Girls who are already sexually active are welcome to join. However, we are trying to educate them prior to them becoming sexually active. The secondary audience of the after-school program will be parents, siblings, and friends of the students, and we hope that they can share the information they learn with them. Our second group will be specifically for our online app and will consist of young Latina women ages 18 to 22 years old who are recently out of high school, working, or attending college. The geographic location will vary depending on a person's location services on their cell phone and the types of resources nearby. We are using the online app to specifically target women who are currently sexually active, with the main goal being to educate, empower, and offer resources for sexual health needs. We created 2 personas to better help our audience understand our message. Our persona of Carefree Camilla represents an individual who partakes in sexual activity but does not know or may not think about the consequences of sexual activity. This can be a result of lack of education from family members, friends, or other members of the community. Our app will target individuals like Camilla who feel they cannot go to family, friends, community members for various reasons, and who feel more comfortable finding information on their own and by their own discretion. Be Catholic Carla. According to our statistic, 85% of Latinos are Catholic. A person's religion can have an impact on whether or not they partake in sexual activity, so a person who is strongly religious may not believe they will benefit from our program. However, our program will benefit them with in-depth education on the reproductive anatomy and sexual health, preparing Carla with information on sexual, reproductive, and pregnancy health for when she feels she is ready.
According to McGuire's Communication Persuasion Matrix, there are 5 key communication inputs: the source, the message, the channel, the receiver, and the destination. McGuire also identifies 4 campaign objectives: announce, advise, advocate, and activate. He states that a message is most effective when it manifests one or even all of these campaign objectives. We will distribute flyers to announce where to access additional information about our campaign, as well as how to follow our social media sites such as Facebook and Instagram, and how to download our social media app and find other resources. Our after-school program will be used to generate awareness and advise young women about contraceptives and how to practice safe sex. The social media app will be primarily used to advocate our campaign and create a network. Our interventions will activate the audience to make smart choices when they are sexually active in order to reduce their risk of an unintended pregnancy.
Our public health theory is social cognitive theory. The cognitive factors we wish to influence are to increase knowledge of safe sex practices. The environmental factors are to change the social norm to make people more comfortable with the idea of talking about reproductive health. and the behavioral factors are to empower people to make safer decisions and not to engage in risky sexual behaviors.
For Cutler's 4Ps, our product is to increase Latina high school students' knowledge and use of contraceptives. The price is increasing contraceptive use and knowledge will decrease the risk of unintended pregnancies as well as catching STIs. The place where we'll be promoting this is in Montgomery High School and Southwest High School. And the way we'll be promoting it is through a phone application and an after-school program.
We will have two components to our intervention. The first will be an after-school program where students will come to learn about different topics regarding reproductive health. They will learn about ways to talk about these topics comfortably with people, such as family members and friends, as well as understand the facts about sex, the effects of sexual activity, and options they have regarding their sexual health. The second component will be the social media app. This is where people can access information about reproductive health and birth control in a discreet and personal way. They can also find resources for reproductive health information as well as pregnancy prevention. Our after-school program is where students will be taught about the basics of reproductive health, contraceptives, and birth control methods. The information will be taught through mini lessons created by health professionals, interactive games, and question and answer sessions. With the involvement of some teachers, we can incentivize students to attend our meetings by offering extra credit for attendance in some of their classes. Prizes and free condoms will also be offered for involvement in the activities throughout the meeting to encourage participation. We will promote the program through flyer handouts and posters that will be placed throughout the high school campus. Also, meetings will be announced through Instagram and Facebook.
For our messages for our after-school program, we will be posting flyers around our targeted schools around campus. We will be posting them around the girls' bathroom and around the nurse's office to make sure our targeted audience are exposed to our messages.
The app will provide general information about sexual health, birth control, and contraceptives, and safe sex practices. The information will be geared more towards someone that is already sexually active. The app will also contain local resources where people can go to get more information or to obtain contraceptives and birth controls. These can include Planned Parenthood, local clinics, or even churches where some may go to seek guidance about their sexual activity. We will promote our app through the Facebook page, Instagram, and the website.
Our messages for our app, we will be posting flyers around local clinics such as Planned Parenthood clinics and the San Isidro Health Center and local college campuses in order to reach our 18 to 22-year-old audience.
This table shows the goals and objectives along with different evaluation methods we will use. First, for activities and process evaluation, we will be using record keeping to monitor activities. One example is to complete a mid-semester and end semester report of meeting activity published by the 8 and 16 week marks. For impact evaluations, we will assess the target audience for knowledge gain. One example is to have a 75 increase in students who know at least one location to access contraceptives by the end of the semester. And lastly, for our outcome evaluation, we will do a study that assesses the number of unintended pregnancies after the program has been implemented by partnering with local clinics.
In summary, Latinas rank highest in unplanned teen pregnancies. We hope to decrease these odds by increasing knowledge and uses of contraceptives. For our prevention program, we will be targeting Latinas between 13 and 22 years old, and our goal is to decrease the risk of unintended pregnancies through a prevention program consisting of an after-school program and an informative app.